Medicine, as we are practicing it, is a luxury trade. We are selling bread at the price of jewels. Let us take the profit, the private economic profit out of medicine, and purify our profession of rapacious individualism. Let us say to the people not how much have you got, but how best can we serve you. Norman Batoon. The world we want. Actions towards a sustainable, fairer and healthier society. Building equitable health systems. COVID-19 pandemic is the worst crisis that has happened so far in the 21st century. How often we have ignored our vulnerability by pretending new technologies and the economic growth rate is all that matters. COVID-19 has caused 6.9 million deaths globally, more than double what official reports show. 140 million people were freshly pushed into extreme poverty due to COVID. 1.6 billion informal economy workers due to COVID-19 and lockdown have suffered massive damage to their capacity to earn a living. And millions of people displaced across all regions. Schools for more than 168 million children globally have been completely closed for almost a full year. And this is the time, therefore, for reflection and for urgent action. A time to rebuild a more sustainable, fairer and healthier society. We explored this theme in 3 parts. The first of which is on building equitable health systems.
कोविड के समय में भी केवल सरकारी अस्पताल ही हैं जो सारी सेवाएं समुदाय को दे रही थी, बिना किसी भेदभाव के दे रही थी। तो जो प्राइवेट हॉस्पिटल है उन्होंने लगभग सब कुछ बंद करके रख दिया था और जहां पर कुछ ट्रीटमेंट की सेवाएं उपलब्ध थी तो वहां पर भी बहुत सारे पैसे जो है समुदाय के खर्च हो रहे थे।
The migrant people are not always covered by the health system, and that is a need.
We also wanted to bring in voices from different kinds of, professionals, medical professionals, community health workers, and the community to help us understand what we mean by building back better. Because clearly, as the COVID pandemic has shown us, it's not enough to simply build back things the way they were before, because they clearly sort of failed to, respond to the kind of situation.
आथे गोठी आथे ओकर बोली हा मीठा थे आथे गोठी आथे ओकर बोली हा मीठा थे नोनी बाबू दाई दीदी के मन लौहा भाथे नोनी बाबू दाई दीदी के मन लौहा भाथे रही थे मितानी ने हमारे गाँव माँ।
मिताइन कार्यक्रम का डिजाइन किया जा रहा था उस समय। अन्य इस तरह के जो कम्युनिटी हेल्थ वर्कर कार्यक्रम जो हैं उनका स्टडी किया गया और उसमें जो फैक्टर थे कि जो सफलता के जो कारण दिख रहे थे उन चीज़ों को इस कार्यक्रम में समाहित करने की कोशिश की गई। फिर इसके सिलेक्शन प्रोसेस में मेथानिन का चयन समुदाय के द्वारा किया जाता है।
हेल्थ सिस्टम दैट इज कम्युनिटी लेड, कम्युनिटी बेस्ड, in which communities' participation is there, from the planning to the, monitoring and evaluation stage, that is very critical.
Ang pandemya ay matutugunan o ang ating pamahalaan ay bibigyang prioridad ang pangkalusugan ng mamamayan, hindi sa sariling interes. Paglalantad sa kaganapan at kalagayan ng health workers para maprotektahan sila. Pagkakaroon ng mass hiring ng mga health workers, pagpapakita ng hindi epektibong pamamalakad ng pamahalaan sa problemang pangkalusugan ng bansa.
Naisasantabi rin ang iba pang isyong pangkalusugan dahil nakapokus lamang sa pagsugpo sa COVID-19, katulad na lamang ng pagbabakuna sa mga sanggol, pagtugon sa mga nagdadialysis, buntis at iba pang may mga karamdaman.
समय पर डॉक्टर नहीं रहते हैं, हम लोग इधर उधर भटकते रहते हैं, दवाई सही समय पे नहीं मिल पाते हैं और जैसे कोई कारणवश से कोई केस मतलब वहाँ नहीं हो पाते तो हम लोगों को बाहर रिफ़र कर देते हैं, तो इससे हम लोगों को भी परेशानी होते हैं। तो हम लोग चाहते हैं कि सभी चीज़ वहाँ उपलब्ध हो।
Some of the patients, they stay very longer, maybe 5 to 10 kilometers radius, so that you cover them. You are not provided even a push bike. You walk on foot.
सबको एकजुट होकर जैसे हम लोग आवेदन बना के देते हैं और शासन के पास पहुंचाना चाहिए ये सब बात को, ताकि सरकार हम लोग का और अच्छे से मदद कर सके। वहाँ स्टाफ को कमी है तो स्टाफ दे सके, CSC PSC में स्टाफ दे और वो सारी सुविधा दे ताकि लोगों को ये परेशानी ना आए।
Government has even more decentralized to Makkalai Thedi Maruthuvam. So we go house by house to give them treatment with trained personals and mid-level health providers. So we have all levels of people who readily take up our services.
स्वास्थ्य सेवा को सुधारने के लिए मतलब जो भी योजनाएं हैं वो सब तक पहुँचे, अमीर गरीब, इसमें जाति धर्म ऐसा कुछ भेदभाव नहीं होना चाहिए, सभी तक मुफ्त में मिलना चाहिए और सभी प्रकार की सेवाएं मुफ्त में मिलें।
Fala, entra em debate, faz reuniões, leva até a comunidade. Também posso falar que a gente, nas comunidades, trabalha com terapia comunitárias, né? É um trabalho lindo, maravilhoso, que é um dos que eu mais gosto de fazer, que é um trabalho que é direto mesmo na comunidade.
The relationship between the provider and the patient, the relationship between the facility and the community, it's a relationship of solidarity. It is a relationship of mutual trust, of respect, where the healthcare is there to be experienced, not to be sold. It's its use value, not its exchange value that determines it. And actually, healthcare is a relationship between the people who are involved in it. That's important.
Y en fin, se estimuló una organización comunitaria en salud muy potente, que fue el Foro Nacional de Salud, que forma parte del Movimiento de Salud de los Pueblos, y se formularon muchas políticas conjuntamente con la comunidad. El foro siempre, el Foro Nacional de Salud y el liderazgo en salud que estaba en su seno, siempre estuvo presente en todas las políticas públicas que se formularon. Diseñamos un proceso participativo para ello. Entonces, todos estos fueron éxitos importantes que de alguna manera hay muchos más. Se eliminó la malaria, por ejemplo, se controlaron las epidemias de arbovirosis. Entonces, todos estos logros fueron una cuestión muy importante, todo lo cual fue auditado por organismos como la Organización Mundial de la Salud y por la Contraloría Social de la misma población.
That we cannot see one thing separated from the other. Both things go together. The human rights engagement, the commitment with human rights, and the commitment with democracy go together. We cannot see these things separately. And I think that is a problem for some health workers that see these things divorce. We cannot see the things separate.
Todo esto debía sumar esfuerzos hacia la cobertura universal de salud, entendiendo salud como un concepto que no está limitado a los servicios de salud, sino que va más allá, involucra el trabajo intersectorial, el trabajo en la comunidad, es necesariamente mucho más amplio que los servicios de salud. implicaba obviamente el acceso universal a la salud y la búsqueda constante de la equidad. Y por supuesto requería también de un ambiente que fuera sano y seguro a través de la promoción de la salud, la prevención de la enfermedad, la curación y la rehabilitación, que son elementos que obviamente no deben faltar.
During COVID-19 pandemic, less disruption of social life, less disruption of other health services, less death cases of the COVID-19. There are very many nations that have done so and relatively did better. Costa Rica, Cuba, Sri Lanka, Thailand, Vietnam, New Zealand, Iceland and many others. What made these nations different?
One of the best things that it is a very inclusive system in the first place. In the second place, that is it's a right for everybody. Public health is a priority for all the governments. This is part of the national identity, the health system, a strong public health system.
Construir un sistema de salud que fuera único, público, universal, participativo, equitativo, que estuviera financiado por impuestos generales y de tal manera que no generara gasto de bolsillo adicional a la población al que ya tributan cuando pagan el IVA o cualquier otro impuesto directo o indirecto. Es el Estado el obligado a devolver ese dinero recolectado en servicios y uno de ellos es la salud precisamente, contribuir a construir la salud en la comunidad.
It's a decision that involves long time. It's not just something that you decide in this government and you will change in the next.
One of the key drivers of national policy should be that payments which are made for healthcare, budgets that are allocated, should not be grounded upon any considerations of commerce or profitability, but considered completely according to requirements and needs.
Costa Rica lo invirtió en desarrollar la salud y la educación, ¿verdad? Entonces, mientras que Costa Rica tuvo un desarrollo intelectual importante de sus instituciones educativas, ¿verdad? Tuvo un desarrollo importante de su sistema de salud, nuestro sistema de salud fue completamente abandonado para estimular precisamente el desarrollo del sistema privado para poder tenerlo como un mecanismo de lucro.
Τέτοιες στιγμές, θα αναφερθώ και κάτι που είπε ο συνάδελφος πριν. Κύριοι συνάδελφοι, διαπιστώνουμε το μεγαλείο του δημόσιου εθνικού συστήματος υγείας και διαπιστώνουμε πόσο ακριβώς άχρηστος και αναποτελεσματικός είναι ο ιδιωτικός τομέας υγείας. Ελπίζω αυτή η διαπίστωση που σίγουρα κάνετε κι εσείς να σας βοηθήσει να συνέλθετε από την ιδιωτικομανία και να ενισχύσετε το εσύ χωρίς ΔΙΤ, χωρίς κρυφές ιδιωτικοποίησεις εκ των έσω, αλλά με γνώμονα το δημόσιο συμφέρον, το οποίο ο ιδιωτικός τομέας όχι μόνο δεν εξυπηρετεί, αλλά συστηματικά υπονομεύει.
The health system in Costa Rica is made out of the contribution from the state, the entrepreneurs, and the workers. So everybody has some kind of contribution. So we know that the health system is ours, belongs to all of us. And I think that makes us more responsible to how we manage and how we use the health system. That's, I think, another important aspect. And the other thing is that Costa Rica does not invest in national defense. It has no army. And that money goes to health and education.
COVID-19 vaccines were developed in a record time. But the virus is moving faster than the global distribution of vaccines. As on 23rd November 2021, 63.87% of people were vaccinated in rich and high-income countries. Only 7.46% of people were vaccinated in poor and low-income countries.
Costa Rica is demanding the international institutions that the patents of different medicines, and especially the patents of vaccines, are avoided and become public property. It's a need for the world to protect all the population, and to be paying patents is a sin. It's a crime against humanity.
To make it happen, especially the fair distribution, there should be a global consensus to make a vaccine, any product, a global public product. And this is a political choice, a political commitment. When we say it should be a global public good, it's not sharing for the sake of sharing. It's only because it has advantages. For the world to recover faster, it has to recover together.
When it comes to what is called non-excludable and non-rivalrous services like vector control or prevention of food adulteration, there has always been a recognition for many preventive services that these are public good. What the pandemic teaches us is that it is not enough if we restrict this term of public goods only to a very narrow category. Curative services that reach even the weakest section is necessarily a public good. And there we are using the definition of public good as meaning an area of inherent market failure.
And you don't have this much of freedom applying in a private sector where we do in a public service. And moreover, every time when you see a patient suffering, you need to worry about his economic feeling also. But in a public sector, you don't need to worry about that. You knew very well that his out of pocket of expenditure will going to be zero, and your entire service is definitely will never going to hurt him in economically.
That all the contractual relationships that had been built up for purchasing care from the private sector did not help. And the public sector, with all its weaknesses, with all its understaffing, with all its problems, still ran the day and still was the major provider of care for the majority of the people. And the same doctors who would be criticized for not being very caring were those who did back-to-back night shifts for days together because they had to. And at some point, that is the notion that comes from the notion of public service.
I work in private as well as in public sector. The main difference between private and public sector is I'm compelled or I'm forced to prescribe multiple drugs in private sector because it is because of the marketing units. But here in public sector, I can prescribe only the drugs that is needed for the patient.
Jan Swasthya Abhiyan or PHM India has been since beginning monitoring, documenting and building evidence on the implications of such a publicly funded health insurance scheme, which brings in the private sector as providers in a big way, and that has actually led to more inequitable health services and higher catastrophic health expenditure. The growing capture of corporate power of corporations over global governance and global narratives that really then promotes policies that put profit over people.
Eso obliga completamente a pensar en otro modelo de desarrollo que no pasa por los objetivos hacia un modo de vida en armonía con la naturaleza, en armonía con el ambiente, que sea sustentable para toda la humanidad y para las generaciones venideras. Entonces, hay que cambiar la matriz energética.
Services in the public sector can compete with those available in your private sector, then your public will actually have somewhere where they can go without without even thinking about what they would need to spend. And that is the dream.
The reform of the health service is, of course, to bring it back into the marketplace and degrade it back again into making healthcare a commodity. So it's not reform at all. A caring capitalism, Miliband is talking about this socially responsible capitalism. It's a bit like the Arabian Phoenix, isn't it? Everyone's heard about it, nobody's ever seen one.
International institutions, both health and financial institutions, should have a broader perspective and a more committed attitude toward health for all, because if part of the world is sick and does not have health, the whole world would be sinking.
Una mattina mi sono alzato, oh vela ciao, vela ciao, vela ciao, ciao, ciao. Una mattina mi sono alzato e ho trovato l'invasor, un partigiano, portami via. Oh vela ciao, vela ciao, vela ciao, ciao, ciao. Partigiano, portami via, che mi sento di morire. Se io muoio da partigiano, oh vela ciao, vela ciao, vela ciao, ciao, ciao. E se io muoio